Ciao Mondo, and this time Merhaba, because we are in Istanbul and we are at the Consensus Conference on DPMAS in different indications, including acute liver failure, acute and chronic liver failure, and liver transplant. So we have one of the member of the consensus team here that will tell us what is the special indication and condition where to apply DPMAS in liver transplant patient. Can you introduce yourself, please?
I'm Professor Volkan Ince. I'm a transplant surgeon and I live in Malatya, İnönü University Liver Transplantation Institute. And our institute is one of the largest volume liver transplant center in Turkey and in the Europe also. So we have too much experience in the extracorporeal liver support system before DPMAS. Now we use DPMAS in our patients.
What do you expect from this consensus of today?
Today, to define the indications of the DPMAS use, which patient we can use, termination of the DPMAS procedure, and side effects. So we discussed all of things in the light of the literature, and we discussed our opinions.
What is the typical transplant patient in which you apply this therapy?
Especially in post-transplant, sometimes our liver graft doesn't work. Primary non-function, early allograft dysfunction, or in our country we perform living donor liver transplantations, and we can face of small for size syndrome and early or delayed phase graft dysfunction. In these stations, we need some supportive therapy.
How long normally do you apply this therapy? How many weeks? How many days? How many sessions?
It depends the patients and the indications, because some patients need retransplantation, and we perform daily until we found a suitable graft.
Okay.
Yeah. So.
But are there patients in which this dysfunction may come to a resolution so that you can stop the therapy?
Yeah. In some situations, it is reversible, so the liver regenerates and the liver recovers, and we use DPMAS in supportive in this kind of patients. But in the primary non-function, this is an irreversible situation, so we need a retransplantation.
So again, this is a very interesting indication that once more expand the horizon of the application of DPMAS, and liver transplantation is becoming very important in many centers around the world, and the competence of these centers to be able to perform extracorporeal support is extremely important. Thank you very much for joining today Cappuccino from Istanbul. And how do you say ciao mondo, hello world in Turkish? Marhaba. So marhaba. Excellent.
Excellent.